This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. And the other part of that jigsaw is that studies as far back as the 1980s showed that in some socioeconomic groups, the father of the child was not the one that the child thought it was in about 5% of cases. So 1 in 20 children in some lower socioeconomic groups are actually not the children of the father they thought they were. That was discovered when they were trying to work out the conundrum of rhesus disease, the blood grouping problem. And in other populations, 2 or 3% is pretty standard. So in the lady having an affair and the husband having an affair, children are born. So those children aren't able to chase down their potential father if they discover that's not the case. So yeah, I think it's still a conundrum. I go along with what's happening, and I'm going along with it because if you don't tell a child, there's a strong possibility with the genetic testing that we now have, when people go and look for their origins, that would turn up, and then the parents are faced with a dilemma in an adult child of being asked, where did I come from? I think it's much better for children in the 8 years plus age that daddy wasn't the daddy, but you're here because we loved you and we chose to use a donor because otherwise you wouldn't be here in the world. That's rebounded I've watched lobby groups where children conceived through donation have been who are also depressed or suffer mental illness stand up and say it was all because I discovered my dad wasn't my dad. I'm not sure that's the underlying cause. So anyway, you may detect that I have a slightly biased view compared with many people, but I certainly accept that where we're going is the right way. But I do not accept that the boys that I recruited in the 1980s should bear any grievance because they did something in an altruistic way. Now a child is saying that you're my genetic father.
Prof, what's your opinion about fertility treatment add-ons in improving the patient's chances of having a baby? And can you give us some examples of fertility treatment add-ons?
Yeah, my overall view is unless there's scientific evidence for add-ons, using them is a waste of time. There are many add-ons, and if you go onto Google, people will try and sell you stuff saying this will improve your fertility, male fertility, female fertility. You go to naturopaths, Chinese herbalists, spend lots and lots of money on medications that have no scientific proof. I'm a skeptic. That doesn't mean I don't prescribe them. When patients come to me and they say they've read this, they've read that, my one question is, will it do any harm? If it does no harm, then use it. The problem in the scientific evidence, and usually there isn't any, what there is, I've treated 100 patients with this medication, and in the last 12 months, 80 of them got pregnant. With all due respect, that's the normal rate of conception of the natural population using no medications. Do they work? I don't think so. But they will claim those successes as due to the medication. And if things get better, it must be due to something. So therefore, taking this or that vitamin or this or that herb must have made the difference. Garbage. Nature doesn't help. Nature is not particularly good in terms of fertility in the human. And 3 months of trying if you're under the age of 35, you've only really got a 30% chance of being pregnant, 30 to 40% chance of being pregnant. So when you panic after 3 months and rush off to the naturopath or whatever, because some friend told you, then, and you get pregnant the next month, that wasn't because of the medication. It was because you got your 15% per cycle that nature always was going to give you.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.